My name is Dr. Darren LaRoche. I'm an eye physician and surgeon, part of the McCune Smith Cordice Medical Society. We're here at PS 33 in Queens Village for a health screening, and this video will give you some highlights of some of our members, some of the screening, some of the activities, and give you some motivational health information. So I hope you enjoy. Thank you.
We were able to be in the executive office of District 29 and also done a lot of programs to show the students what medicine is like. And we're hoping to have a partnership, even if you're not interested in medicine, like you think you might be. It will be awesome to be able to know from us what the experience is like. It is an organization of physicians, doctors of Black race, and we like to show our appreciation for the underserved minorities and to show you the way to become doctors, and if not doctors, anything that you want to be, because if you read it, if you see it, you can be it. Thank you.
Hello, doctor. Please introduce yourself.
Okay. I am Luis Benzi. I'm a psychiatrist practicing in Brooklyn, New York area.
Thanks for coming to this educational health fair. What do you want the youth to know about anxiety?
Well, okay, anxiety is one of aspect of mental illness, but what I would like to bring about is let people know what the difference between mental health and mental illness, because I think that we have a lot of misunderstanding about those two. Mental health is the well-being, the way that we are functioning well.
And what do you recommend for the youth?
For the youth, be aware of what's going on around them. Mainly when we're talking about mental health, make sure that they eat well, they exercise, they stay away from any bad thing for the youth. So when you're talking about mental illness, that has to be taken care of the same way someone has glaucoma, same way someone has high blood pressure, because this is a medical condition that needs to be taken care of.
Thank you very much.
You're welcome.
Thank you. Okay, we got Dr. James Satterfield. Go ahead, introduce yourself.
Hi, I'm Dr. James Satterfield. I'm a general surgeon. I do operations. I take care of patients and hopefully make them very happy. What's important is that I give them an education as to whatever disease process they come into my office with. I think that's important that when they walk out of my office, not only do they feel relieved, but they also feel knowledge.
So what's your message for the youth?
My message for the youth is to go to school, study math, study science, because that is going to be your future. There's math in everything that we do, whether we buy a candy bar in the store, or take a date out to the movies, or think about purchasing a car or a home. So it's important for young people to understand math, to learn English, and to study science.
Thank you so much. And we got Dr. Gus.
Hi, I'm Louis August. I'm a surgeon and surgical oncologist, and I take care of people with cancer, but also with other general surgery issues as well. And I think my role is not only to take care of the problems the patient have, but to help them anticipate problems that might develop in their life and how to deal with it. And then sometimes you're successful, sometimes you're not successful, but even when you're not successful, there are ways to support the patient throughout the whole process. And so I see my role as a doctor to be with the patient, the family, from the time the diagnosis is made until the end, or either cured or not.
And your message for the youth?
So I think medicine is a great profession, and I really enjoy what I do because you're part of a very important part of society. You make people better so they can continue to take care of their families, continue to do their jobs. So I would encourage a lot of you to choose that path because is very rewarding, very rewarding. No greater satisfaction than to see a person was sick, was suffering, when you help them get better.
Thank you so much.
Pleasure.
For coming to the health fair, please introduce yourself and your message to the youth.
Hi, I'm Dr. Francisca Polite. I'm one of the OBGYN doctors. My message is to always continue learning. Learn about yourself, your body, your culture, your history, medicine, health. Do what you can to keep learning, to keep that brain going, and to keep teaching others as well.
Thank you.
Hi, I'm Dr. Lorraine Williams, also OBGYN. My message, strive to be the best that you can be. Don't let all the noise interrupt you and take you away from your focus. Do what you are meant to do. It may take a journey, it may take through pins and needles and up and down, but eventually you'll get there. Do what you're meant to do.
Thank you. Okay, can you please introduce yourself and tell us what your message for the youth is, please?
Well, good afternoon, good evening. My name is Alan Tolles. I'm an obstetrician gynecologist, and my message for the youth is to, whatever you put your mind to, you can do it. Because I've learned through my experience that if I can do it, anybody can do it. So you stay focused, keep your mind and all the distractions away from what your goal is, and you will be successful in whatever you do.
Thank you very much. Thank you for coming to this health fair. Please introduce yourself and tell us what your message to the youth is.
My name is Gitel St. Victor. I'm a psychiatrist, consultation user psychiatrist, and my message to the youth is always remain positive, always do your best, and my personal motto is ad astra per aspera, which is you should always reach for the stars. Always reach for the stars. Don't settle for anything lower than what your goal in life is. Always reach to the stars because you can do it.
Thank you so much. Thank you for coming to the health fair. Please introduce yourself and tell us what your message to the youth is.
Hi, my name is Dr. Sonia Ventur. I'm a gastroenterologist, which means I'm a specialist for the gastrointestinal tract. I've been in practice for over 25 years, and I encourage all the young people to consider medicine as a profession. There is actually a significant need for African American and Hispanic physicians. I encourage you to study hard, be persistent, don't be discouraged by roadblocks you may encourage along the way, and also reach out to physicians like us who can help guide you in succeeding in whatever profession you choose.
Okay, great. Thank you so much.
You're welcome.
Thank you so much for coming to the health fair. Please introduce yourself and tell us what your message for the youth is.
You know, my name is Anthony Joseph. I am a physician. I do internal medicine and nephrology. But currently, I'm the Dean of Admissions for the College of Medicine at Downstate. My advice to you guys, whatever you are doing in life, do it very well because people are watching. I say, for example, I never ask anyone for a job, okay? Whatever I got is just because people ask me to do something for them.
Thank you so much.
Okay?
Thank you so much for coming to the health fair. Please introduce yourself and tell us your message for the youth.
I'm Dr. Charles Bessie. I'm a child and adolescent psychiatrist practicing in New York. My message to the youth, please take care of yourself, practice mindfulness on a daily basis, and you will find.
Thank you so much. Thank you so much for coming to the health fair. Please introduce yourself and tell us your message for the youth.
Okay, I'm a medical oncologist. My name is Dr. Joseph Duroso. I've been in practice in Brooklyn for many years, and I'm focusing on closing the disparity on women's health.
And your message for the youth?
The message for the youth is to know themselves, to know their body, and to be aware of all the places that we have at their hand to look at for resources if they have any problem. Because as an oncologist, a lot of people tend to hide themselves and they don't know what to do. I come to let them their resources available, and they have to come, forward, in front. If they have a problem, there are people here to help them out. That's why we are here.
So oncologist, that's like a cancer doctor.
Cancer doctor.
So you want all the kids to make sure they bring their parents and grandparents to get checked for cancer.
It is very important. If you know in your family they have a story of cancer, you should be aware to speak with your parents that maybe, mom, you should be check your gene to see if you have an abnormal gene that I can be inherited from you. Will be important to speak with her. Maybe they will be more aware of that than their family member. So I want them to know that they are, it's easy to check yourself with a blood sample and go for it.
Thank you so much.
Okay.
The backbone.
Is it the spine? So where does the baby
So that's
come
when
out
you know
from?
right behind
so
that.
where does the baby come out from on the side? Like,
Well, you just said it.
wait, how do they come out? No, how do they? Oh, right here. Wait, how do
Well,
they?
it actually would come out from over here. What is this?
But it comes out from down here. That's the butt. Oh, belly button.
The belly button. So the baby actually comes out. You came out of your mommy by C-section. You said, right? You came out like right here.
How did the baby get in there?
Oh, because you
Tell me.
so first because of the dad and the mom. No, so you supposed to like get a boyfriend or like have a dad and then you can pray for a baby. And then no, you don't pray for a baby. Pray for a baby.
Why can't you pray for a baby? Why can't you pray for a baby?
You have, you have.
What is you know?
Sex.
There you go.
You have sex in the
When
bed.
you're old enough.
You have sex in the bed and then someday probably it comes
How
out.
this happens.
They're talking about how it comes out.
How long does it happen in here? How long?
They're talking about how you get a baby.
Does this happen the next day? Does this happen the next day?
No, you have to do it 4 days. No, it's like 9 months.
Oh,
9 months.
perfect.
9 months.
For full-term, full size baby. 9 months.
So where is the baby gonna come out?
Right here.
So I'm wondering, like how does a regular baby how does it slide out? How does it slide out?
Well, look at this.
Well, they have
What is
to
this for?
squeeze.
What is it in?
Know a lot about sex.
It's in the uterus.
Wait for right
What
here.
does the
Does the
uterus
baby come out?
Huh? It comes out right here, or we talked
Comes
about
out
the belly.
but that's out right here. That's
But that opens up. It opens up. The uterus is a